Welcome back, friends. We are here with the new topic, that is the abdominal swelling. So, that is the swelling present on the abdomen, the fullness of the abdomen, and let's see what are the today's objectives. So, objectives of the today's session are definition, cause of abdominal swelling, differential diagnosis, what are the approaches to a case of abdominal swelling, which are the points we have to take a note for the history taking, which are the different clinical examination, which are the different investigation and evaluation of the abdominal swelling. So I hope you can enjoy the today's session. So let's talk about our first objective, that is the definition. Abdominal swelling is referred to an abnormal enlargement or the distension of the abdomen, which may be due to the fluid accumulation into the abdomen, gas accumulation, fat, masses, or enlargement of the abdominal organs. So basically due to some gas, fluid, fat, masses, इन सब की वजह से जब एब्डोमेन एनलार्ज होता है और डिस्टेंड माने लटक जाता है, सो उसको हम लोग एब्डोमिनल स्वेलिंग बोलते हैं. So let's see what are the different causes of the abdominal swelling. So first cause, fat. Fat causes the obesity. When there is accumulation of the fluid, it is considered as ascites. If there is a flatus, so it is due to the intestinal gas. If inside the abdominal cavity, in the uterus, the fetus is developed in pregnancy, and severe constipation and the fecal impactation, that is of feces. So remember the 5F, that is the mnemonic 5F: fat, fluid, flatus, fetus, feces, right? It is an easy way to remember 5F. So fat in obesity, fluid in ascites, flatus in intestinal gas, fetus in pregnancy, and feces into the constipation, right? So let's see the another additional causes of the abdominal swelling. So additional causes: first, tumor, any tumor of the abdomen or the pelvic neoplasms. Organomegaly, hepatomegaly means enlargement of the liver, enlargement of the spleen. Some hernias like umbilical hernia, inguinal hernia, hiatus hernia. Cyst like ovarian cyst or the mesenteric cyst, which is happen into the ovary or as well as into the intestine. Inflammatory masses like tubo-ovarian abscess or the appendicular lump, appendicitis, or the bowel obstruction, which can causes the leading to the gaseous distension, right? मैं आपको सिंपल समझाता हूँ. जब भी वजन आएगा, means in the case of fluid, in the case of obesity, in the case of fetus, and at that time the abdomen swelling, it is a downward distension, लटक जाएगा, right? And when there is gas accumulation, like gaseous distension, so वो ऊपर की तरफ फूलेगा, right? So these are the main causes, and we can easily identify what may be a cause of the abdominal swelling, right? So let's see what are the differential diagnosis of the abdominal swelling. So first, that is the ascites. In ascites, we can in examination we can found that is a specific dullness, fluid thrill, flank fullness. We see into the next lecture in specific ascites. Second one, that is the obesity. Obesity में uniform swelling दिखेगा. There is a no shifting dullness present, and the abdominal wall is a thick. In the pregnancy, apart from the distension of the abdomen, you can find the amenorrhea, positive pregnancy test. You can hear the fetal heart sound over the abdomen, and the patient is feeling the fetal movement inside the abdomen, right? Fourth one, that is the gaseous distension. When you do the percussion, you got the tympanic knot, and the patient have a blotting, right, like that. And with the help of the stethoscope, you can found the gurgling sound, which is called as a borigmy sound, right? Other one, that is the masses. Any mass or a tumor, that is the palpable lump with the defined borders. And if there is a severe constipation, so fecal impactation, there is a lump into the left lower quadrant, and there is a history of the severe constipation. And in the case of organomegaly, you can find the palpable liver and the palpable spleen. Basically, into the normal condition, the liver and the spleen are not palpable, and you can doing the specific examination and specific palpation of the consistency of the organ and the consistency of the severe borders of the organ, right? So these are the differential diagnosis of the abdominal swelling. Now let's see what we have to how can we approach a case of the abdominal swelling. So first approach to a case of abdominal swelling. So if it is a, we have to ask it is onset, sudden or gradual. So if it is a gaseous and the other ruptured, it is a sudden, but in ascites, in the case of pregnancy, in the case of obesity, in the case of uh, other constipation, so the gradually onset is there. Duration, we have to ask regarding acute or the chronic. We have to ask the progression. So it is increasing the swelling. It is a stable or the fluctuating, right? So in ascites, in pregnancy, there will be a stable condition. Sorry, in increasing condition. In obesity, it may be a stable or the increasing. But into the gaseous condition, when there is a flatus, so it is a fluctuating, right? So we have to ask about the associated symptoms also. So pain, vomiting, weight loss, altered bowel habit, jaundice, and the menstrual irregularities. So from this information, we can easily identify what may be a cause of the abdominal swelling. We have to ask about the past medical and the surgical history also, and we have to ask for the diuretics or any hormonal therapy, because some hormonal therapy can causes the obesity, right? We have to ask the family history also, genetic condition, or regarding to the cancer, right? So these are, we have to take a step, or the we have to approach in the case of the abdominal swelling. I hope you can easily understand how can we approach a case of abdominal swelling. Now let's move further into the history taking. In a history, we have to ask the first chief complaint. So swelling कब से है, duration and the progression we have to ask and assess. Then associated pain or the discomfort we have to ask and assess, and relation to the meal, कितने बार खाने के बाद, खाने से पहले कितने बार टाइम में, दिन में टाइम ऑफ डे कितने बार खाते हो, क्या लेते हो, सो उससे ओबेसिटी का भी पता चल जाएगा. We have to ask the associated symptoms like nausea and vomiting, which are present in the pregnancy. Into the severe constipation, they are the present. We have to ask the bowel and the urinary habits. So due to the distended bladder, the abdominal swelling is here, in the constipation. So from this history, we can assess what may be a cause of the swelling. Right, we have to ask about jaundice. If there is a jaundice is present, so involvement of the liver is there. So easily we can identify, and we can ask the menstrual and the obstetric history into the female patient. So we can assess the pregnancy also. And we have to ask about the systemic symptoms like a fever, weight loss, and the fatigue. So from that we got there is the inflammatory condition happens into the abdomen. So from this history taking, we got the much more information, right? Now let's see into the history taking also. We have to ask about past history for the tuberculosis, any lung disease, because in the tuberculosis, any liver disease, there will be a risk to develop the ascites. In the case of malignancy, previous surgery like a laparotomy or the cesarean section. So from that we can also identify what may be a cause of the abdominal swelling. Now we do the clinical examination. So first in the clinical examination, we are starting with the general examination. So we have to ask about a nutritional status. We can find the signs of the anemia, check the nail, check the sclera, check the tongue, and watch about the jaundice, cyanosis, and the edema. Then we have to perform the palpation for the lymphadenopathy. So if any lymph node is enlarged, it suggests there is an inflammatory condition happens into the body. Right, now we move on the abdominal examination, systemic examination. So first, when we do the inspection, so we have to watch about the shape and the symmetry of the abdomen. So shape of the protuberant happen into the obesity and the other condition like a pregnancy, distended into the flatus or into the gaseous distension, and if any masses occur onto the uh, only one side of the body, so the symmetry will be altered. Visible vein, it suggests more, and the scar and the pulsation, right? And hernial sites, we have to check about the hernia also. Into the palpation, we can doing for the shifting dullness, we will see later into the next lecture. Fluid level in ascites, it is again we can assess with the palpation, and if there is a gaseous distension, we got the tympanic knot. In auscultation, we found the vowel sound. So if it is an obstruction, that is the increase, the vowel sound, and borborygmi sound you may hear. And if there is a paralytic ileus, the vowel sounds are the decrease, right? And if there is a renal artery stenosis, so you can hear the bruit sounds also from the abdomen, right? So these are the systemic examination, right? We move on the other part, that is the investigation. Which investigations are useful to rule out what may be a cause of the abdominal swelling, right? So first we do the basic blood test for the rule out the anemia infection, CBC. For the liver function, we can do the liver function test, renal function test. We can perform the serum amylase, serum lipase for the pancreatic causes. We can do the tumor marker like a CA125 and AFPCEA for the rule out any cancer tumor into the abdomen. Other are the urine examination for the proteinuria. Because of the proteinuria, hypoalbuminuria occurs into the body, and there is a risk of the development of the ascites. And from the urine infection, we can suggest that is the cystitis also. And in the early cases, we can perform the UPT, urine pregnancy test also. So these are the basic investigation. So after basic investigation, if we can't found any condition, or if can't found any cause, we move on the other investigation, and they are the imaging. In imaging, first we do the ultrasound abdomen. This is the first choice, and the pelvic first line for the ascites, and the organomegaly and the cyst. So first choice, that is the ultrasound abdomen or USG, and we can do the X-ray abdomen standing for the rule out the air fluid level or the obstruction. We can perform the CT MRI also for the detailed evaluation of the masses or the retroperitoneum. We can perform the chest X-ray to rule out the TB for in the case of suspected tuberculosis ascites. We can do the endoscopy also if GI cause the suspected, and ascitic fluid analysis, SAG means serum ascites albumin gradient. So जो ascites का जो fluid हमने पैरासिंथेसिस करके निकाला है, उसको हम उसके अंदर albumin कितना है उसको हम उसका gradient को हम नापेंगे, उसको हम बोलते हैं SAG. And another, that is the cytology for the ascitic fluid, and the cell count and the culture of the ascitic fluid we have to perform. Right, now let's see what are the different evaluation basis on the clinical scenario. So if you found in examination fluid thrill or the shifting dullness, likely diagnosis is ascites, and for the further evaluation we can perform the USG, ascitic tap, and the SAG. If there is a palpable liver with the firm edge, we can likely diagnose hepatomegaly, and rule out USG, LFT, and CT scan is useful. If there is a central symmetrical distension with the tympani, central में आएगा, distension आएगा, symmetrical होगा, so that is the gaseous distension. So in the X-ray, CT abdomen, we can rule out that gaseous distension. If a patient have a amenorrhea, lower abdominal bulge, and likely diagnosis is a pregnancy, so it is a urine pregnancy test or the USG, we can confirm the pregnancy. And any hard lump into the abdomen, So likely diagnosis, that is the tumor. So we can perform the tumor markers or CT and the MRI. Right. So friends, in today's very short topic, I hope you can easily understand what are the causes of the abdomen, what are the abdomen swelling, what are the different uh, evaluation method, and what are the, how can we approach, how can we examine the case of the abdominal swelling, right? So once again, thank you very much. I hope you can easily understand your objectives of the today's session. If you found any query, you can contact me, you can comment me as per every time. So once again, thank you very much. Stay safe.